COVID-19, I sent all my love to all of the moms out there who are struggling at home without PSWs, without their support people, without their nurses overnights. Very rightly, medical moms have had to suspend care for their children in the early days of COVID, making the decision not to have people come in their homes. That makes total sense. Sadly, moms did not get any, here in Ontario, any real direction. Very few got contact from their nursing agencies, the coordinators of programs, to check in on how they were doing in their in-home ICUs, their in-home worlds of caregiving, their bedside caregiving that they are doing. They are invisible to a lot of levels of healthcare. And in that context, they are just hanging on. They are doing everything that they do in the normal world, but they're doing it on their own. The reason that the kids need healthcare supports is because they require the attention of a mini ICU level care, but it's in home. Hospitals and institutions want to send kids home, and the benefits of sending somebody home is that you're comfortable, you get to sleep, not like in the hospital. I mean, you're around family and friends, but it requires support. It requires support similar to in the hospital, but at just more community level. And it's cost efficient to be at home. But it's not cost efficient when you are at home and you are the one doing the 24/7. Even with supports, it's still a long care journey for you and your body, your mind, and your soul as a medical mom. And that requires people show up and do the work that they need to do. That requires that agencies take time to look at their training, PEDS-specific training. And that requires that the healthcare system allocate dollars to make sure that there's pediatric-specific care, attention, and training. I believe Kids Come First, an Ontario initiative, is looking to do some of that coordinated service about pediatrics, coordinating care between hospitals and community. It's an initiative. It is, we don't know if that's going to be an ongoing thing. So God help us that we don't have COVID that, takes out our children, because then we would have, sad to say, an in-home care problem, not a long-term care problem. However, they're both part of the same parcel currently. All right, well, that one's a little bit harsh, isn't it? So here I am today. I wanted to show you this tool for any of the medical moms out there that aren't aware. There's this amazing resource called Complex Child. I'll show you this website. Oh, look at all my tabs that are open. Whoa. Okay, well, so Complex Child, and I will put the post in there, the address there later, has this great flow chart about should I cancel my child's nurse or aide. Now, it's US specific, but it has the same fluency as a Canadian parent, an Ontario parent that has to look at whether or not I want somebody to come in. And does your area have cases? Yes or no? And then you continue on. No, then you can go all the way down here. That's a lower risk, right? Yes, it does. Does your nurse or aide have other jobs? So this has become a problem here in Ontario. Some nursing agencies refuse to tell families where or if their workers have other jobs. And the workers have been directed to also not talk about whether they have other jobs. I know globally, the Eastern Ontario has done work to separate workers from long-term care homes and home care. So at least there's that. you continue down this chart to decide, do you want your workers to be at your home? Workers work in the hospital, they work in a nursing home. Do you want them? No, they're higher risk, right? How many other families do they work with? Just one? Could be okay. Two or more? Higher risk, right? We're in an age of contact tracing at this point. So, you know, these are all important questions. I'll put the link in here, don't worry. You can go and check this out. There's amazing articles on complexchild.org. Fantastic resource for families, medical moms who are medical moms who are raising amazing children who happen to have complex issues and life-limiting disease and illness. So I hope that that is valuable to you right now as you're trying to decide moving forward, as everybody's sort of slowly coming out of quarantine or sheltering at home, that you can find some guidance. It's a flow chart, but it's guidance. And I hope that organizations that are supporting you will come up with some more guidance and certainly some more touching base with you, collaborating and working as partners. Feel free to contact your support systems and ask them for support. You're going to need it. All right, take care. Peace out. I love you. Bye.